Good
Okay.
evening, everyone. I'm Dr. Sridevi Call. I'm doing this podcast called Silver Chats on geriatric dentistry. And today I have as my guest Dr. PC Jacob, a renowned prosthodontist. Sir did his BDS from Manipal and MDS from Annamalai University in 1994. And he maintains a private practice since 1998, focusing on maxillofacial prosthodontics, dental implants, and full mouth rehabilitation. Since he has such a wide experience working on edentulous patients, which we equate as geriatric patients, I thought it would be nice to have a chat with Sir, know his experiences and what's the path forward. Sir, welcome to our studio. And we would like to hear from you about your experiences and if you can share a few cases or speak about them today. Thank you.
Yeah, thanks, Sridevi, for that kind introduction. I never considered myself a geriatric dentist. I always consider myself a maxillofacial prosthodontist, because of my training with John Bumer at UCLA. And, I spent 25 years after coming back from there rehabilitating these maxillofacial cases. But then Sridevi asked me for a couple of cases just to show the work. And then when I was going through my work, I came to understand that 35 to 40%, I think, of the patients that I treat are geriatric. The only confusion I have is at what age group do you call somebody geriatric? In India, it's different. In the US, it's different. And geriatric patients world over suffer. And, even as a postgraduate, I never liked to do complete dentures. I just thought that doing complete dentures was a disservice to our patients. Removing all their teeth, unless they are extremely, really, really badly gone, is a disservice to our patients. Because once you remove the teeth, then, the bone just melts away after that. And of course, implants, of course, have made a huge impact in rehabilitating geriatric patients. And as dentists, what I find is that most dentists only think of, when you're talking about implants, they only talk of all on 4 and all on X and all the fixed work that is there. A lot of them don't talk about the removable part, overdentures. You have a senior citizen, they have a mandibular denture which is floating in the mouth. Just put in 2 implants, put some attachments on them, and you can change their life forever. And that's what we are going to show in a couple of cases that we have today. So I'm just going to share my screen.
Sure.
And yeah. So this was one of my patients. And she's a senior citizen, a very, very nice lady. And she came in and, she was saying that her lower denture was loose. So I worked very closely with maxillofacial surgeon, Dr. Anjan Shah. And we have been working together for more than a decade, and we think alike. And so in this lady, we just simply suggested 2 implants for her. And we have found in our hands, Straumann tissue level implants really work well. And they have an attachment called Novalock. And just two of these in the mouth can make a huge difference to this patient. As you can see here, we have picked up the attachments. Everything is done like a complete denture. And then we pick up these attachments in the mouth, and you can see that she's really, really happy with that. So just a simple treatment like this can absolutely change the life of your patients. And earlier, people used to say, especially in the maxilla, that you need to splint all of them together with a bar and all of those things. But those concepts are changing now. So you can probably do similar thing in the maxilla, but instead of 2, I would probably go in and put 4 inside. Of course, if the height of the implants is less than 10 millimeters, then I would still splint them with a bar. But otherwise, I'd just go with, I'm not advocating that you use Straumann. You can use any system that you want, and all systems have got good attachments, and they make the life of your patients so much easier for them. And this is one case. And the second case is even more dramatic. So you look at this patient here. She has these teeth with reduced bone support, but they are only grade 1 mobile. And again, Dr. Anjan and myself sat and thought about it, and we said, why should we extract those teeth? They're in good shape. Okay, they may not look brilliant, but they serve the purpose. So we took a CBCT. CBCT is standard of care for all patients now. We went and put into alpha bio implants there, allowed it to osseointegrate. And you can see that we have made a cast partial denture, which is primarily retained in the maxilla by the attachments that we have. And in the mandible, we have just gone in and given her a regular cast partial denture. So rather than go in and extract all the maxillary teeth, and put in X number of implants and try to do a huge fixed processes for her, we have changed her life by just doing very minimal treatment, but she is one of the happiest patients that I know now. So you don't need to do elaborate treatments for all patients. Yes, in some cases where the teeth are grade 3 mobile, then you have no choice but to go in and extract all of those teeth. And we have a very dramatic case which I had shared with Dr. Sridevi. And probably in a future podcast, I will show you how a situation where we now go in and actually immediately load these implants. We are now confident that if you get good primary stability in these implants, you can immediately load them. And hopefully, we will have the opportunity of doing that in a future podcast.
Sure,
One
sir.
thing to remember is that these geriatric patients are scared. They don't want to come to your chair. And if you can give them something with much less amount of treatment, they will forever be grateful to you. And that is what I have learned from these patients.
Thank you so much, sir, for sharing these wonderful cases. It's like as you mentioned, you've taken the simple treatment planning as your mainstay here, and changed the quality of their life. We surely look forward to learning more from you in future podcasts. I remember that case that you showed me that was more dramatic than these. But again, as you said, 10% of India's population is completely edentulous, is a staggering millions of people. So we
and also 60% are partially edentulous.
Partially edentulous, yes. I did not know that. That's to even think of it.
Same here. I did a little bit of research for the podcast.
Yeah.
And I found that this is a 2021 article from from an Indian author, and it blew my mind. 10.7% is completely edentulous, and it's much more in the rural than in the urban, obviously. And I'm not saying that we can't do all on 4 and all on X and all of that. But what I'm saying is we need to judiciously think of the treatment plan, looking at the patient and seeing how they are. What is their medical status? Look at all of that, take all of that into consideration, and then form your treatment.
Right. So that again brings us back to the objective and the kind of mission of this whole our geriatric board, that we are wanting to train these younger generation, taking your experience and expertise, and everything, how you can with minimal treatment, you can change the quality of life in so many patients. Because everybody does not need, as you said, a full arch fixed, or it's not needed in all cases. And so much of human resource, time, and finances get utilized this way if you can distribute our expertise like this. We would love to listen to you and learn more from you in a future podcast, sir. And the cases you presented here are like, there's so many aspects to it that we can learn from. And we would love to continue the series of podcasts, and we will meet you again, sir. Thank you so much.
Absolutely. My pleasure. Absolutely. Thank you so much.